Let's talk mastectomy incisions and why you as the patient really should be involved in deciding what incision pattern is best for you. The reason why it matters is that your scars will live forever on your chest, and it really does impact your long-term reconstructive outcomes. Now, there are some instances where we don't have freedom. If you have cancer that's close to the skin or invading the skin, that skin has to go. So we're going to design our incision with that in mind. But that's often not the case. When you think about a mastectomy, you have a nipple sparing and a skin sparing, and they are what the name implies. Nipple sparing spares the nipple and the areola. A skin sparing spares the skin, but not the nipple and the areola. The traditional way of doing a nipple sparing is with incisions underneath the chest, so envision where your underwire of a bra would hit you. That's a great incision. It's well hidden and allows us to access the breast. Sometimes the surgeon can even do the sentinel node from that incision. Well hidden, love it. You know what I hate is a radial scar. A radial scar is one way to do a nipple sparing approach that just should never be done. Envision this is my nipple and my areola. A radial scar is going to start at the lateral aspect and extend towards your trunk. Now, initially, it looks great. You saved your nipple areola, it's hidden in the side boob, but over time, it looks terrible because scars contract. And as your scar contracts, it's going to pull your nipple areola lateral. And you know what's impossible to fix? A lateralized nipple areola. Just say no to radial scars. Now we move on to skin sparing territory. So a skin sparing options include a horizontal scar across your chest. That's the traditional way that skin sparings have been done. Also hate them, never offer them to my patients. The reason I hate them is that your breast should be projecting this way, right? And when you have a straight line incision across your chest, it flattens your chest like a hamburger bun. Even if your breasts are ginormous, they look like a large hamburger bun. So it's really challenging for me as a reconstructive surgeon when someone has had this scar, they come to me for a revision, and their main complaint is lack of projection. There is nothing I can do to overcome that apart from doing a flap surgery and bringing back some skin into that area. So I do not like horizontal scars. What I love are vertical scars. A vertical scar is going to remove your nipple and your areola in a vertical plane. Why I like this is that initially it looks like a smushed egg, but over time as the breast relaxes, it's going to look more natural because that incision is in line with the breast. I also love a wise pattern scar for large breasted women who want to decrease the size of their breast. That's a vertical scar combined with a horizontal. I think it's almost like a breast reduction. And when you have a 3D tattoo, it honestly looks like a breast reduction. Beautiful. Let me know what questions you've had about incisions. Let me know what incisions you've had. And most importantly, let me know if you had a choice as to what incision you had.